FDA approved for like a shot and 2 boosters for infants for COVID, I would never do that. I would rather have them get COVID and build up their immunity towards it.
When you're microdosing, the nicotine gum, you're supposed to like only chew it for like 10 seconds and spit it out because most of them have too many milligrams of nicotine. A country with a healthy population, they don't really need to spend that much on healthcare compared to US.
A lot of people have difficulty getting access to physicians. You really don't have people to turn to, and it's going to be less and less.
If you're getting these DIY things, you got to do your research.
Supposedly there's some people self-compounding. It's like the free silicone implants and stuff we still see.
But there's so many other things. It's not just go become a doctor because of the thought of becoming a doctor.
Prestige isn't there anymore.
You find a really good idea, you want to pursue it, I'll back it. You don't really need to go to college. Welcome to the Doctor's Life podcast. This episode, we're going to be covering topics such as parental skills, setting goals for your children, Zyn
or nicotine, how low-dose nicotine can help with cognitive abilities. We also talk about the COVID-19, what we think of the vaccines.
There's fiberglass in there that cuts
and
puts nicotine into your system.
It doesn't.
Fiberglass in a patch?
It's a pouch.
Yeah, so the fiberglass, I haven't looked it up, but like the Zyn pouches don't have the fiberglass. Fiberglass was in the skull or chewing tobacco. That way they make the small microabrasions in your gums.
Yeah.
So you absorb some of that stuff. The pouches, since Zyn and snus, I don't think either one of them have the fiberglass shards. The chemicals are put into like these almost like wood chips to keep it almost like a solid compound so it doesn't completely dry out.
I don't use anything now, but I've used that and I end up getting withdrawal headaches. I was just getting withdrawal headaches just from taking like once in a while.
I got to see what these things are.
But then you take the same, you just have like nicotine gum, which is the same dosage.
Though. Well, you get withdrawal headaches.
Well,
is it because that's longer release?
Is nicotine the thing when you're microdosing? The nicotine gum, you're supposed to like only chew it for like 10 seconds and spit it out because most of them have too many milligrams of nicotine
inside them.
Yeah.
I mean,
it's different doses. I don't know. I haven't gotten withdrawal symptoms from like anything. I think it. No, I'm serious. Like, because I drink like a lot of caffeine, and I'll go like a few days without it, and everybody talks about the caffeine headache. I'm good. I'm fine. I don't know. Like, it's nice to have that.
Yeah.
I think it's individualized response.
Yeah.
But I just like to, instead of the fiberglass, I like to just slit some lines in my gums and just rub cigarettes in there.
Yeah, that's why. That's the only reason I have steak knives.
Because I don't like fiberglass.
Steak knives are good for you.
So I take nicotine because it helps with how fast you think. It helps with memory, reaction times.
I need to think faster.
Like when you're trying to do lots of busy work or like get some of the work done, like looking through before and after pictures and trying to go through files and files or studying it helps with memory. I guess they're trying to use it on Alzheimer's patients, which is improving the effects.
Why? Because they remember to take nicotine?
Yeah. For me, I take the troches, which you don't get the added benefit.
What's a troche?
So a troche is a tablet. You place it under the tongue. It's one of the fastest ways to get it into your system. Yep. You know, nasal spray or troche is going to be good for that. The only thing I don't like about the troches is sometimes you're trying to get stuff done or you need to rinse your mouth and it just lasts way too long under the tongue.
You can butt chug it.
How much is it? How much is in it?
You can get it 1 to 2 milligrams.
Okay.
So it's not much.
Along the same lines of nicotinamide?
No, that's what I was thinking. Like, is it just because the nicotine's a precursor for your nicotinamide? I'd have to check. I've kept on thinking about it, and like I didn't really look at it. Whether taking that with the NAD nasal spray, I've done them together.
What are the negative side effects though? I mean, even low dose, it obviously has like, does your heart start going faster?
For some people, they may get irregular heartbeat with it, but like. For me, I didn't notice any difference.
I'm not even saying like irregular heartbeat.
Not irregular, but
like even increased like 10 beats per minute,
I wouldn't know.
Most likely. I mean, it's obviously hitting your
I guess I could try
system,
it tomorrow. I have my
why wouldn't
Whoop
it, right?
in my ring. I could see if my heart rate goes up.
I'm going to start doing that, like just testing out different meditation techniques on like baseline heart rate.
Yeah.
I'm trying to figure out a nice way to do it. Because I did notice some changes with like the box breathing.
Breathing techniques. Do you use different breathing techniques that bring it down?
So I'm trying to use different breathing counts, breathing techniques to see how it like affects my heart rate immediately. And then also in like a 15-minute span.
You know, one of the weirdest things I'm like, and it's tough not to eat before you sleep, but like whenever I eat late or like if I have a steak before going to bed, like my heart rate's like 90 to 100 going to sleep, where regularly it runs at like 70. And that's one of the main things I've been trying to get down and get my HRV up. Your HRV, your heart rate variability, being low means that you're stressed out and not recovered enough, which I don't know, over the years. Like,
wait, this one part I didn't like, I couldn't wrap my head around the heart rate variability.
Yeah.
Because I would, like conceptually, I would just be like, well, you want less variables. That means you're like in a steady state.
Yeah.
So why is higher variability thought to be more healthy?
It's how your heart responds to, you know, how quickly
different stresses and like what your thought process, especially like in REM sleep.
Yeah.
But what's your resting heart rate like during sleep?
It's usually in the 70s.
70s? Same here. I want to lower it to 60s.
Yeah. So that's why
I'm not doing exercise.
That's why I bought the Carol bike. To see if I could change my heart rate variability and my resting heart rate to decrease them, because like an 8-minute bike ride 2 to 3 times a week, you could get the same effects as, you know, jogging 60 minutes every day.
Has it been 3 or 4 weeks?
Well, I went to France a few weeks ago, so it's been two weeks.
Those Frenchy croissants.
Yeah. The Frenchy croissant.
Baguettes.
Well, I
really
think
crushed his
one thing
AI
is
bicycle routine.
One thing is kind of like, I don't know, my son caught something, but I didn't catch it as bad, but I probably
got fish?
Some sort of flu.
Yeah, there's something going around.
Like, I didn't really feel that sick, but like my throat kind of felt scratchy. But whether it's that or just the time changes,
you weren't chain smoking cigarettes with the rest of the French people.
Oh man, that's like the worst thing. Like, you think the whole Paris is indoors because it smells like smoke.
Yeah.
Like anywhere you go, it's like just in the air. It's crazy. Maybe my brain wasn't hyper-functioning.
I picture a bunch of mimes.
Oh my God.
Chain smoking.
Our cousins are French, and I went with one of our cousins, his brother-in-law. We went to Morocco. He's Moroccan. And I think every 10 minutes we were at a different hookah bar. I was like, I can't do this physically. Like, guys, I really gotta, like, I need to go home. I can't keep doing this.
I need some fresh air.
It was like coffee, hookah bar.
Covers your 4 food groups.
You guys both have kids. You're in the medical profession. Yeah, I have kids too. But like, are you going to teach your kids to become physicians, or what do you want your kids to become? Or like,
I'm not going to force Arya to do anything, but I might just like tape a bunch of surgical instruments to her hand where she can't remove it. So if she can figure out her daily functions through surgical instruments, like eating lunch, cleaning up after herself. I'm kidding. I don't force her. Like, she says she doesn't like blood. She's 12. I respect that. I don't think that's going to last as a feeling. As a profession, I don't know, because the recent reports show that your CPI inflation index shows common goods, rent, food growing 10 to 20% over the last 5 years. And I think it was 5 or 10 years, and physician reimbursement on average has decreased close to 8%. It's like 7.75%. So if it's for the money, definitely not. If it's something you like doing, go for it. But I think even more like, since you've been in training or you were in training, Like, how many people do you see like work their butts off to get like their ideal training spot, and they just drop out? They go completely like left field. You're like, I did not see that happening. Like, oh, okay, you got into orthopedics at Harvard, and like, I'm going to go on the business side of things. Yeah. Stuff that's not even like, you don't even need like a medical degree for. I really don't care. Whatever she wants to do, I'm going to back. And because if she wants to do something, she's going to be better at it. Because she's got that inert drive. Yeah. So as far as like pushing kids to do something for your gain, I don't agree with.
How about college? Are you pushing her to go to college?
Sarah and I just had a fight about it because I was trying to make a point with Ari, like, you find a really good idea, you want to pursue it, I'll back it. Yeah. And you don't really need to go to college. And I heard it that night when Ari went to bed. It was like, this is something we need to talk about and agree on before you tell Ari you don't need to go to college. I'm like, but it's kind of true. Like, do you really need to go to college?
Yeah.
Going to a good school now is like 60 to 80 grand a year, counting living expenses. And then med school is another 80 to 100 grand a year.
At least like med school, you learn stuff that you use, right?
More relevant stuff. Yeah.
Compared to college, which was like, I don't know why I'm taking these courses, but well, for you took a lot of courses that you probably like.
I dropped out before the semester was over. So it dropped the bill a little bit and it extended my undergrad stay.
Ram, I know you're young and your son's like almost 2, but like, have you like talked it over with your wife about like what you would do? Would you tell him to be a dentist? Would you tell him to be a physician?
I think I would probably.
That dude smashes a lot of shit.
He does break a lot of stuff. He's probably going to be a boxer. But no, I definitely thought about it. I don't know. We don't really have much time to talk, I feel like, nowadays with the wife. But mostly from my perspective, it's similar to Rod, where I'm just like, whatever he wants to do and it's something he enjoys doing, that's ultimately what I want him to do. Yeah. And if he wants to become a doctor, I obviously will guide him and let him do that and tell him to go for it. But at the same time, I will definitely warn him against, you lose your 20s and you're legit. Like, I love what I do now, but there's a lot of people that I know in a lot of fields within medicine. If you just look at suicide rates, other rates of lifestyle, things like that they go through all this expecting something at the end. And then the end comes and they're like, oh, I just gave up everything. And now I don't really have an out. And now I'm stuck. I have to do this, And that's the part that's like, you guys told me many times early on, you guys told me, you're like, dude, if you want to do this, make sure you want to do this. And, that's why it took me 5 years to end up doing it in between school, which I respect and I'm happy about, because it's like, make sure you want to do it. It's very rewarding if it's what you want to do. Yeah. But there's so many other things. It's not just go become a doctor because of the thought of becoming a doctor.
Prestige isn't there anymore. And with more private practices closing down or not closing down or turning over to becoming hospital employed or run by private equity, like you become an employee, you might not be shoved in a cubicle, but like when they tell you got 15 minutes to see your patients and you got overhead bosses, that kind of removes everything from you, right?
Independence is kind of dead.
Yeah.
So like
you don't get to make your own mind. And the patients think it's your fault when we don't have that issue. We're in a different atmosphere, but like mainly talking about like, especially the primary care aspect. One thing is like physicians are getting burnt out more. And once they get burnt out, they don't really care about what they do with the patients, about like having to see the patients to keep their job.
A lot of times coming back to what he said, like the amount of effort they put, and now they're like kind of like trying to force themselves to be like, this is who I identify as.
Yeah.
This is my label. This is who I am. This is part of who I am, my personality. Subconsciously, like it's like a self-fulfilling prophecy where you just keep doing it for the sake of doing it because you feel like you've been told to do it and you worked so hard to get there that you just kind of like make it work. And it's not best for your patients. Yeah. But you just kind of like one day to the next and just roll with the punches. And if they don't like it, they go to somebody else. Yeah. And a lot of people have difficulty getting access to physicians, quality physicians. So like you really don't have people to turn to, and it's going to be less and less.
And like today I was reading an article, it was on Medscape, and it was like nurse practitioners and PAs, like quiet quitting. That's what they called it. And it's kind of like this whole burnout situation. They're not getting respected by like the medical assistants and other staff in the office. They don't get respected by their bosses, which are usually the physicians, but sometimes it's the non-physicians, the managers that aren't as educated as the physician assistant or nurse practitioner. They're just going to see these patients and it's just motions, like for 15 minutes, like they just get them out the door. They're like, all right, we got to just get these people through. And, we have the patients that come in and we just sit down and talk to them, and like, they complain about some of the primary care physicians, and because I go through all aspects of like trying to get them healthy and, when they need surgery, to be part of that, to make that difference, because it all out, it just makes me feel better than just, being like, no, you just need to get out.
You're another human being. I'm a human being too. Surprise. I care about how you're doing overall. It's that aspect's gone. It's becoming more regimented and more ridiculous. As far as like, it's a job, getting the job done.
For me to answer this, I'm not going to force my kids to go. If they want to do it, I don't know. My son might do it because he thinks there's girls in the office all the time. That's what he's interested in at the age of 3. He always wants to go to the office with me, but I'm not going to force him. Like if he's passionate about something.
Yeah, that's the thing. It's like realistically, let's talk numbers. Yeah. Like how is this scene evolving? Yeah. And what you want to do and why you want to do it. Yeah. Like if you're doing it for your name, for salary, whatever, is like wake up. This is old school mentality. This is not like real life.
So if they were gonna go into medicine, what would you tell them to become? Pick 3, your top 3.
Top 3 medicine. I honestly think oculoplastics is one.
I was going to say plastic surgery, but I've seen this guy. I think oculoplastics might be the way to go. You can focus on just this part.
Well, the thing is,
my one chapter of my textbook, I can focus on.
Well, my top 3 are like, with plastics, you could just do noses. You could just do breasts.
So all jokes aside, I would pick plastic surgery as one of the top ones just because it has a cash component. I don't want to be dependent on the insurance system. That is one of the main reasons. Outside of like everything I get to do, like the diversity of care, diversity of patients, young patients,
just autonomy, patients,
the big autonomy. And autonomy. And I don't necessarily think everybody, like a lot of people that go to med school want that though. So there's a lot of people that even before getting into training want to like sign up for a job and just have everything lined up for them. Cause that cash flow business of plastics is also managing small business. Yeah. That's not attractive to a lot of people, and they're willing to put money on the table to not deal with that. I know one guy, he's in Rhode Island, he's a brain surgeon, happens to be the only brother that's not here.
The broke brain
That's kind of, so
BBS. We'll call him.
Yeah.
I'm like plastic surgery, anesthesia, or dermatology. Plastic surgery.
Anesthesia is really good.
Yeah.
I did not appreciate
I'm probably the only plastic surgeon that the anesthesiologist tells what to do. Yeah. It's usually the opposite way around.
You are married to one.
Yeah, anesthesia.
No, I know me also. I listen to her also.
The part about plastic surgery for me is like, you get to do so much, not just in the aspect of surgery, but like running your own business. And like, there's so many different aspects to it that are very like attractive. Well, to me, some people don't want it. But
I love that. Yeah. And I also hate listening to people telling me to do, you know me for a while now, but like, I don't like just sitting there listening to orders. Yeah. Like I don't respond to that well. Yeah. I don't work well in that environment. I'm not to say, I don't listen to anybody, but I do listen to like a couple people, Sarah, Pyam. That's pretty much it.
And good part about anesthesia is you put patients to sleep. When you go home, you usually go home. You don't got patients to see you don't got clinic. So those are nice parts, especially if you don't like, interacting with patients as much.
I honestly lose more sleep between the operation and the first post-op visit about patients than any other time. Like that's when my mind goes, this is a little off topic, but it goes like kind of crazy. And I'm like, oh God, like I could have done this better, could have done that. And then you just see them in the post-op period. It's like, oh, it's not doomsday. They're really happy with the results. You're nitpicking like those tiny little fixes.
The thing is, you got to just, a lot of it's pre-planning and look at the pictures and pre-plan. And when you mark it out and you do it enough times, you're like, all right, you know exactly what to do. And like even the little tweaks in the OR. And I think what's going to make a huge difference for us is when we have our own OR, it'll be a little more relaxed than when you're at other places. It's kind of like, the workers on your shoulders, like, when are you going to be done with surgery? Although I don't listen to anything. I just become super focused in the OR and I just do what I got to do.
Yeah. I've tried talking to you in the OR.
So
you have to be talking to you in person too. I hope you're super focused on something because it's definitely not this interaction. This is the only reason we actually do this podcast. So he actually listens to what I have to say.
Yeah.
Usually it's just like,
The wives ask, like, you guys talk to each other? Or like, no. They're like, didn't you operate together? We're like, we were operated. So
sounds
we
exactly
made
like all his responses. Yup. Nope. Hi. Yeah. Yeah. That's about an hour of our time together in the operating room.
Last week we were going to talk about, we saw there's a surgeon in California.
AMA put out the 5 specialties that spend the most time in electronic health records, recording notes and whatever they have. It wasn't like really shocking which specialties spent the most and least time on, but the pure amount of hours is absolutely absurd if you like step back and look at it, because you're not getting paid or reimbursed by insurance companies, Medicare, Medicaid, whatever, except for your allotted this many minutes spent with in-patient interaction. Yeah. So the worst ones, any guesses?
Psych, infectious disease.
So infectious disease is number 1. Infectious disease, nephrology, endocrine, primary care, and hospitalists. Those range from 7.2 to 8.4 hours per 8 hours spent with a patient. So 1 hour to 1 hour. You see a patient for 45 minutes, you're writing a note for 45 minutes or putting in orders, whatever. That's crazy. That's absolutely ridiculous, because even if you work 80 hours, that means you're spending 40 hours with a patient, 40 hours just documenting.
And like Medicare's keeps on decreasing RVUs year after year. And RVUs are what the hourly rates are.
You got to crank the system until it breaks. That's what they're doing.
Until people are not willing to see patients. And we're already seeing it. Like more and more people are going to cash based.
Getting better care too.
Yeah.
I don't think many people, but some people think, oh, it's like physicians are part of the problem. Now it's like, okay, we've decreased in reimbursement for 10 years.
Yeah.
And now 8 cents for every dollar in the U.S. healthcare system goes towards physician fees. That's 8%.
Yeah.
Everything else goes towards like insurance, administration, all the marketing even.
Yeah. So what are your thoughts about the whole Bernie Sanders was on Von Theo and he was talking about how great Canadian healthcare is. What are your thoughts on that?
Why in Arizona? Why in Arizona do we still get Canadian patients?
Yeah, I know.
Cash pay Canadian patients.
Cash pay, like there's physicians that are totally
the Canadian
based.
System is totally working.
Yeah, see how long it takes you to get a total knee or total
Where are they
hip.
going to go next?
Yeah.
Guadalajara?
Yeah, like there's the guy doing like 6 cases.
We're going to just keep pushing them down south.
Yeah, he does like 6 cases, 6 totals a day just on Canadian patients.
They don't have a separate private insurance.
They do, but that's even backed up.
Yeah.
Oh, okay, so you can't get in with anyone.
And the physicians, they can't make any more money,
dude.
They
can't afford it.
No,
like you're gonna wait. Like a knee replacement isn't an emergency. You're gonna just have pain for 2-3 extra years.
Yeah.
And get steroid injections. And I do strongly think that we're gonna walk ass backwards into a single payer system within like 5 years because of how much the insurance companies keep screwing over the system overall and the reimbursements and the margins they're making. It's going to get to that point where even physicians are going to be like, you know what? It can't get any worse. Let's go single payer system, everybody else on the wait list or cash pay. And then people are going to find out how this system hasn't worked well in Canada, hasn't worked well in England. Like they've had issues. There's obviously definitely a middle ground, but it's not where we're at. And at that point, the insurance companies are going to finally see it because they're going to have to start settling for Medicare, Medicaid rates for all patients, even the healthy patients.
And I think the other problem is, like sometimes people compare it to like a country with a healthy population that, they don't really need to spend that much on healthcare to compare to US, which like capitalism's taken over and they've fed these people all this crappy food.
The US is like the closest to open capitalism market you get.
Yeah.
Except for medicine. Medicine is not like people are like, oh, this shows that capitalism didn't work in medicine. It's like, no, this is very blocked off.
Yeah.
There's a significant amount of medical costs that comes directly from like government funding.
Yeah.
This is not a open market. Everything's blocked off. There's zero transparency in pricing. There's even small things like insurance companies. If your employer's offering you insurance, there's usually one company to choose from.
Yeah.
And then on top of that, even if you have more than one company to choose from, you go online and even their provider base is not accurate. It's like, this guy doesn't do that procedure. I work with him in the hospital. He hasn't done that procedure in 3 years. So even if you're going to shop for different like health insurance providers, you're getting garbage information, false advertisement. So it's broken on like multiple domains.
Glad we don't have to, it's not our primary source of patients and plastics.
Yeah. So if you're going to go into medicine, make sure you have some type of cash flow business to follow up. Hopefully it is your medical practice.
Back to specialties.
Yeah. Back to specialties.
Well,
what are the least?
Well, all those people you said, right? I do agree with the documentation side of things. Obviously, we have to document for insurance purposes, which is real. But I also think that every specialty you named, they know what they're going to do without even seeing the person. Not saying they shouldn't spend more time with the patient rather than be on a EMR.
Well, a lot of patients just diagnose themselves now. So
that's also true. Yeah. I think, infectious disease, they can look at they look at everything in the computer and they know what they're going to do. They say what they're going to do. Most of the time, hospitalists, they can look at vitals, labs, et cetera, whatever they've obtained and say, okay, this is what I'm going to do with the patient. But I'm not saying that, obviously, that's holding all these physicians back from actually taking care of the patient when there's a computer sitting in front of you and you have to do all that charting.
Let's go to the specialties with the least amount of
orthopedic surgery, neurosurgery.
Orthopedics is one. Any guesses on your end?
Plastics.
Ortho definitely makes sense.
The most amount of time spent trying to hammer a square cube through a circle hole.
Urologist.
It can't be neurosurge though. I wouldn't think. I think neurosurge has
just they have their neuro exams huge.
It's good. Yeah, they have a lot of huge exams. Ophtho has a good exam.
Yeah, you guys spend way too much time
on our
show up with their briefcase.
Plastics probably.
All right, anesthesia, ortho, ENT.
But like anesthesia's on it 24/7.
And surgery. No, but then like you have anesthesia cases where
anesthesia
they're doing like 6-hour cases, and a lot of it's automated because this is self-reported, like how much time you spend. Yeah. So like for stuff like vital signs, they have to keep up during the thing. So like per hour.
For sure.
I think their interactions are generally longer, except for like those short cases like endo and stuff.
Oh, but they're general notes wise.
And it's self-reported. So there's like orthopedics usually reimburses better, so they're probably more likely to have more mid-levels doing that stuff.
Well, and Medicare's just added on top of that whole primary care stuff, like how they, you know, what they need to have, and they have to hit all the dots before, you know.
So just check. Those specialties run 2.5 to 4.3 hours per 8-hour workday.
Yeah, it's
for
still
documenting.
Too much.
That is
still a lot.
That is nuts.
Way too much.
Yeah.
That is absolutely nuts. If you work 40 hours, let's say if you work 40 hours at Home Depot, you go home with 20 hours of unpaid work where you're just documenting how many 2x4s you sold, which way you sent the guy down to aisle 38 to plumbing and stuff, having to like document that stuff. It's so inefficient. That's crazy that like the best fields are 2.5 to 4.3 hours per 8-hour workday.
Yeah, it's insane. I mean, I know I've seen numerous doctors. I mean, they just leave their note. Like,
that's a huge part of burnout too, the EMR times.
And then it's like, okay, I'm going to go home, enjoy my kids, and then I'm going to write my notes at 9, 10 p.m. at night.
That's why I taught Ari from early on how to do my notes for me.
Yeah.
I speak to Ari in dot phrases. Just bring up advanced MD.
I just write them down. Yeah. I mean, that's why I like my specialty. My notes are quick. I only have to document like 2 things. It's not a whole ophthalmology note. I document like 2 things, and then I do my assessment and plan. It's like, this is what we're going to do, and we're gone. I hate documenting. I don't know if there's anyone who enjoys documenting. And then a part of it also is it's protecting yourself too, which a lot of people have to do because of malpractice and people coming after you nowadays too. So that adds another layer of things that people don't really know about.
Kind of along the same lines, there's an article posted on Axios about DIY medical care. So it's interesting. There's certain things like I'm not surprised about. Their patients are going to Reddit on finding ways to rig their Ozempic pens to be able to like take like the stuff they're going to like throw out, like draw it into different syringes so they can go with like smaller doses for longer periods of time because of the cost of the medicine. Again, going to Reddit, even Facebook groups for medical knowledge instead of going to physicians.
I had the patient, was it last year or the year before, that her daughter did a DIY Kybella sort of thing that she injected into her neck.
That's terrible.
So, and she had like a real bad infection in the neck. Obviously, you know what I think about it. I like Reddit because the one thing is like a lot of reviews you can't trust online anymore because they're like, even though they don't say sponsored, they're, you don't know if they're sponsored by or affiliates with product, and then you'll see like 10%, write my name on there.
Yeah.
Are they giving you an unbiased, even sometimes they say they're unbiased, but like you can never get a true review, and you go on Reddit, you get more of like the true review.
It's like crowdsourced.
And some of the stuff's kind of crazy,
way out there.
Because like for my son, I was like, all right, when's a good age to, change him to a booster seat? And I saw all these people like going off on people that asked the question that like before, before 5 years old,
between 6 months to 18 years old.
I'm like,
it's a good time to transition.
Yeah. Anytime before 5 years old, everyone was going off on them. They're like, oh no, you should be reported to CPS
When's the appropriate age to hit my kid?
Yeah. So if you're getting these DIY things, you got to do your research. And like,
supposedly there's some people self-compounding, trying to make their own GLP drugs. It's like the free silicone implants and stuff we still see.
You got to kind of just worry about people are getting stuff from China, and they'll, like people are on Reddit telling them these are credible, although some of them get taken off, especially like when they're trying to sell the compounded peptides and stuff, and tell them which ones to get from where. You never know. We've heard the stories of like people injecting themselves with stuff that was laced with fentanyl and dying. They thought it was something different. So not a good idea. It's not a good trend to be a part of. I wouldn't do it. Just
one thing, reading this article, they put a special note in like the last paragraph. Like, and there's people that are experimenting with fecal transplants, but they don't understand the risk of running fecal transplants without knowing what pathogens are in them. If anybody out there doesn't know what a fecal transplant is, like you're literally eating a crap pill, like somebody else's poop in a pill, and it like resets some of your microbiomes in your gut. It's shown really good results for inflammatory bowel disease, certain types of inflammatory bowel disease.
But I thought it was an enema they gave.
You can do an enema.
Yeah.
You can butt chug it. You can take the pills. But they just taking random people's feces in pill format. It's like, let me take a shot at this.
Yeah.
So for COVID, self-medication, there was a lot of stuff reported, and like going back, I had like really strong opinions. There's some variable data. There's like every time it's still on TV, you're like, if it's COVID, Paxlovid, anytime I see stuff like that, it's like, stop pushing stuff for patients to push their physicians to give you. If they don't know about it, it's probably not that good.
I've been seeing ivermectin quite a bit, like everywhere. I've just seen it pop up more when I'm on like more wellness sites, and even like some of the compound pharmacies. It seems like it's getting coming up a lot more.
Or added to certain.
Did you guys get your flu shots or COVID shots?
I did not.
Will you get it? So infectious diseases saying.
You mean COVID shot? You got your COVID vaccine.
New boosters.
I did, but I haven't gotten a booster in about 3 years.
You got your vaccine.
I did. Initially. I felt differently, and for a certain reason. Yeah. Like early on, it was effective, and that was just kind of tapering the spread to not overthrow the healthcare system. I was never backing it like this is a cure. You're never going to get it, and it's just a virus. A virus is going to. Like people told me, I'm telling them like, oh, you can't say that this is going to cure anything. I was like, no, that's not what I said. Like this is at this stage right now, like its efficacy is good enough to prevent some hospitalizations.
Yeah.
This is back in 2020, 2021.
Now they're treating it pretty much like the flu vaccine. They're trying to just guess at like if they can catch whatever. Yeah.
I would say one thing.
It is
it FDA approved for like a shot and 2 boosters for infants for COVID? I would never do that.
Yeah.
I would absolutely not do that. If I had an infant right now, I would rather have them get COVID and build up their immunity towards it. because I don't think it's that effective, and that's for the strain right now, not to mention the strain that will be here in 12 months.
Yeah.
Because viruses.
I'm pretty sure my son's already had it. That's 8 months.
Oh, yeah. Oh, definitely.
And 3 years old. So.
And it's like you saw that bounce in kids getting hospitalized after everything opened up. Like, I'm not anti-vax. Ari's gotten pretty much every vaccine. I'm
against the flu and COVID vaccine.
The flu is just... I don't get it.
It doesn't make sense to me. Yeah.
The numbers just, because it's like some years it's like 10% efficacy. It's like more years out of less years. Over the last 10 years, it's been less than 20% efficacy. Is like, does that really help? Like, I've also seen hospitals with like 8 to 10 hours. This is before COVID.
Yeah.
I was trying to get a friend through the ER for a medical emergency. And they were like, it's a 12-hour wait. We just have a bad flu season.
Yeah.
So I don't know. Like, I don't know how those numbers work, because I know the flu vaccine is like a guessing game on what strain is going to be popular. Yeah. But I haven't seen good data to say like, oh, even if it's more than 50% efficacy, that makes sense. That's going to like mathematically reduce the amount of patients that could potentially have that by a lot, then don't need to be hospitalized and use up resources. So I don't know. The COVID vaccine, I haven't seen anything promising since the first.
I don't know why they're even still giving it. That's like,
it's FDA approved for infants.
Yeah.
3 shots.
I just think they mess up your immune system overall. So I'd rather have my immune system fight it itself. And I use like the different peptides to kind of fight off.
So it's different. There's certain vaccines like varicella, mumps, measles, rubella works really well.
Yeah.
Polio works really well.
Yeah.
Bacterial vaccines work really well.
Yeah.
The viral vaccines, you got to kind of question it, like weigh the benefits and risks.
There's just a
lot
of
like hepatitis vaccine, I'm going to make sure my kids have it.
Yeah.
That's a viral illness, because the risks aren't that high, but the benefits of not having hepatitis for the rest of your life, or getting hepatitis B and having to take 12 weeks. HPV is huge, because like just going through our medical training, it's like reduced the amount of HPV related cancer, cervical,
mouth,
ENT, oral cancer, or throat cancer.
Which the oral cancer part's kind of crazy, and it's like you're seeing it in some young patients, and you're like, what the hell's going on?
More than 30 to 50% people carry it. You're going to see like a crazy amount of that.
Yeah.
Yeah, I mean, I could go with, even though flu is not, and I honestly, personally, I'm like, I don't want to get the flu every year, because I'm like, we're very obviously immunocompetent, and if we get the flu, we'll get sick, but it won't be too bad. But I guess you always,
I've gotten your mind, pretty sort of like from the flu, where it's knocked me out to like 5 days.
I have too, but the people that are going into the hospitals are obviously immunosuppressed people, so it's like.
But it matters. Some people are, their toe hurts and they go to the hospital.
I personally feel it's not like doing immunology research and stuff is with your T memory cells and stuff, because your immune system's more hyped up, ready to go, and responsive when you're young, and it develops a memory response. Yeah. So you actually want to get sicker when you're healthy and can get over all these illnesses. Yeah. So it builds up some memory. So if you're like 70 and getting exposed to something you were exposed at when you were 20 and you got really sick from, when you're 70, your body only needs to use a little bit of energy to fight that off. Yeah. So it's like this balance.
Is it now that we have kids that we realize, like we see kids like Shai and Saran, it's like kids they just have runny noses for like a solid month and a cough for like 2 months.
Well, I hadn't, Ari's like 10 years older than them.
Yeah.
So,
until like 6, 7, they pretty much,
get sick. It's just consistent. A bunch of snot-nosed kids.
Yeah. Like before we went to Paris, I kept him out of school for like 3 days just so he wouldn't get sick 3 days before.
Now Ari's sick, and I send her to school, be like, you are the vaccine. Go spread amongst these healthy kids.
One thing we wanted to hit on was, since we're talking about this whole vaccine and stuff, is like our post-op management, there's new peptides that are out there that are replacing some of the older ones. Our Wolverine stack that we usually prescribe from post-operative care comes in a pack. It's 4 peptides. 3 of them are shots, and one of them's troche, which is under the tongue. The troche's the GHK copper that helps with the healing process. It's anti-inflammatory, but also helps with building collagen and healing those scars. Tesamorelin helps with release of extra growth hormone. It's going to help with the healing process as well. And then the pentadecapeptide, which is a synthetic form of the same thing as BPC, which since BPC has been taken off the market.
Does pentadecapeptide literally translate to 510 peptide?
Probably. Yeah, I don't.
I mean, it has to be.
Yeah,
Socrates.
It's a 15 amino acid.
There you go,
peptide.
15.
Yeah.
We got our answer.
And BPC is a 15 amino acid peptide as well. Only difference is like BPC is better for GI healing, which, you could still take a oral BPC. So the injectable, I thought the injectable BPC was better for healing. So we have this injectable form of BPC along with TB500, thymosin beta-4 now.
TB4.
That will help with the healing process with your T cells. It's for tesamorelin, pentadecapeptide, thymosin beta-4, and GHK-Cu. Comes in a pack of 4. And so you cycle it for the first month.
In one pill?
No, it's 3 shots in one pill.
It is 3 separate shots?
Yeah.
How often?
You could mix the pentadecapeptide and the thymosin beta-4, although a lot of pharmacists say not to mix them. Most of them are, 5 days a week, 2 days, the weekends off, and you do it for a cycle of the month.